name's Karen, and today we are going to be doing an assessment of Hank's thoracic spine. So we're going to start with a posture assessment. From the frontal view, we're looking at the symmetry of the eyes and the ears, which appear normal. Looking at the level of the shoulders, which is a little bit lower on the right side, and the symmetry of the ribs and the sternum compared to the clavicles, which appear normal. From the sagittal plane, we're looking at the curvature of the cervical spine, which is slightly lordotic, looking at the shape of the shoulders, which are rounded. We have some kyphosis in the upper thoracic spine into the thoracic region, and then scapular position appears normal. From the posterior view, looking at head position, which appears centered, level of the shoulders, once again we're seeing more drop on that right shoulder. Position of the scapula, which appears normal, a little bit more pronounced on the right side, and the level of the iliac crest, which appears normal. So now we'll be assessing active range of motion in the thoracic spine. We'll be looking for quantity, quality, and willingness to move. We'll start with flexion, and in flexion we will see superior and anterior glide of the inferior facet of the superior vertebrae on the superior facet of the inferior vertebrae. For the ribs, we will have a superior glide with an anterior roll. So what I'll have you do is cross your arms over your chest, bring your chin to your chest, and roll forward for me. We're going to stabilize through here. Any pain?
No.
All right, so now I'm going to apply a light overpressure to assess for end feel. Any pain?
No.
All right, and the end feel appears normal. So now we'll look at extension of the thoracic spine. In extension, we will have an inferior-posterior slide of the inferior facet of the superior vertebrae on the superior facet of the inferior vertebrae. In the ribs, we will have an inferior slide and a posterior roll. And I'll have you lean back as far as you can using this part of your back. All right, so as far as you can go? Any pain?
No.
All right, I'm gonna add some overpressure. Any pain with that?
No.
All right, assessing for end feel, and it appears normal. So now we'll look at lateral flexion. In lateral flexion, the inferior facet of the superior vertebrae on the ipsilateral side will slide inferiorly, and the inferior facet on the contralateral side will slide superiorly. Lean as far as you can to the right side while keeping your bottom planted. All right. Any pain?
No.
All right, so now apply slight overpressure. Any pain there?
No.
Okay, and the end feel appears normal. Any pain there?
No.
All right, apply overpressure. Any pain there?
No.
All right, and the end feel appears normal. So now we'll look at rotation. With rotation, we will have the inferior facet of the superior vertebrae sliding on the superior facet below. And then rotate as far as you can to the right side, keeping your bottom on the ground. Any pain?
No.
All right, so add slight overpressure. Any pain there?
No.
All right, end feel appears normal. So rotate as far as you can, keeping your bottom on the table. Any pain?
No.
All right, slight overpressure. Any pain with that?
No.
All right, and end feel is also normal. So now I will assess the active range of motion of the upper thoracic spine. So I've already marked C7, the spinous process, so I'll place my left thumb there, and then count down T1, T2, to the spinous process of T3. And when we are assessing this motion, we're looking for quality and quantity and willingness to move. So Hank, if you could bring your chin down to your chest for me. And my left thumb on the C7 spinous process moves superiorly. And then you can bring your head back up. And the range feels normal. For rotation, my thumbs are in the same spot, so on the spinous process of C7 and T3. And we will be looking for same quality, quantity, willingness to move, as well as symmetry. So you could turn your head to the right, Hank. And I can feel the spinous process of C7 moving to the left. And then if you could turn your head to the left, please. And I can feel the spinous process moving to the right, back to the center. And the motion appears equal and normal. So now we will assess the passive range of motion in the upper cervical spine. So I'm placing my middle finger between the spinous process of C7 and T1. And what we'll start with is we'll move Hank passively into flexion, just assessing for movement in the inner space. And then we'll go into rotation to both sides. And then into lateral flexion. assessing for quality, quantity, willingness to move. And we don't need to go through the full range of motion here. So now we will assess the first rib active motion. So what I'll do is I'll move the neck musculature out of the way so we can access that rib. And we're looking for elevation when Hank breathes in, and for depression when he breathes out, and for equal symmetry. So if you could take a deep breath for me, and then exhale. Right. And it appears normal and equal. So now we will assess motion in the ribs. For the upper ribs, ribs 1 through 6, our motion is going to be in the sagittal plane. So I'm just going to have you continuously take some deep breaths. So what we're looking for is, with inspiration, we are going to have the ribs and the sternum move in a pump handle fashion, which is going to increase the diameter from anterior to posterior. And then when we move into the lower ribs, our motion is going to be in the frontal plane. So you can take some deep breaths. And so we're going to see the ribs move in a bucket handle fashion, which is going to increase the diameter in the transverse plane. So now we will assess the passive motion of the first rib via the spring test, and we'll be looking specifically at the costo-transverse joint. So in order to do that, I'm going to rotate his head towards the side we're testing, which will be the left side to start with, and that helps relax the muscles. Once again, I'll have to move those muscles out of the way to access the rib. In order to find the right placement, I will go from the spinous process of T1 laterally. We'll find the transverse process, and just lateral to that is where I will place the web of my hand to do the test. So I will apply a caudal glide towards the contralateral hip. We're assessing for recoil. And then we'll compare that to the other side. So move his head to the other side, and then place my hand on the first rib, and once again apply a caudal glide. And it appears equal and normal on both sides. So now I will assess the passive mobility of the thoracic spine. In order to do that, we will use the posterior-anterior spring test. So I will apply pressure to each of the vertebrae on the spinous process using the hypothenar eminence of my hand. And I will apply that pressure in the direction of the vertebrae. So starting in the upper thoracic, the pressure will be applied in a posterior-anterior direction with a slight inferior angle. And with each one, I'm going to be assessing for recoil, making sure that we have full recoil to determine the mobility. All right, and then I'm going to reposition as I move into these lower vertebrae. From this position, we're just applying posterior to anterior. All right, and now that we've assessed all of them, we can compare, and his mobility seems normal with the exception of some hypomobility from T5 to T7.